Greetings and salutations. It is I, the Rim Whisperer, coming to you once again to talk to you about the myths, mysteries, and mechanics of sleep. Thank you for joining me on this episodic journey as we delve into all of those myths, mysteries, and mechanics. Last week, we talked about snoring. The previous week, episode 1, we talked about what sleep is and some ways to help build a healthy sleep architecture. Today, we're going to tackle sleep apnea. A lot of people wonder, they say, I don't have no sleep apnea. I don't got no sleep apnea. It's sleep apnea. And what it is that a lot of people think that you stop breathing throughout the night. That is not 100% accurate. Sleep apnea involves frequent disruptions in breathing during sleep. And these disruptions, they significantly reduce sleep quality and contribute to a greater risk of health problems such as cardiovascular disease. And people with sleep apnea, with this common sleep disorder, they don't realize that their nighttime breathing is abnormal. Most of them don't even realize that they're having these apneic events, these upper airway respiratory disruptions. They don't have that. So, knowing more about the types of sleep apnea, as well as the causes, symptoms, and treatment, can allow people to assume a more active role in improving their sleep architecture and overall sleep health. So, let's jump right into it. There are two main types of sleep apnea. They both disrupt the breathing and cause cessations in breathing, but there are really significant differences that affect their diagnosis, symptoms, and how you treat them. The first one we're going to talk about is called obstructive sleep apnea, or OSA. Obstructive sleep apnea is estimated to affect between 10 and 30% of adults in the United States, making it the most common form of sleep apnea. The air during OSA, the air cannot move through your airway because your airway is not patent. Once you have established a patent airway, the air can move freely. But when your airway is not patent, it cannot move freely through. And this happens because the surrounding muscles and tissues in the airway slacken, constrict, and eventually collapse. And that can trigger partial awakenings to restore breathing, fragmented sleep, and making your overall sleep less refreshing. So that's saying that when you're asleep and when you're snoring, when you're doing that, that right there, that is your body triggering a partial awakening to restore breathing because your airway is blocked off by your tongue or the muscles have collapsed on each other and it's just blocked off your airway. Now, with that one, you didn't really stop breathing, which is where the common misconception comes in, is like where your spouse will tell you, baby, you stopped breathing. You stopped breathing 20 times last night. I counted. Well, you really didn't stop breathing. The airway was just obstructed. Because if you look, your chest and your abdominal area is still rising and falling in attempt to breathe. The mechanism is still there. The mechanics are still there, but just no air is being produced. That is what obstructive sleep apnea is. Now, central sleep apnea, on the other hand, it only affects less than 1% of people. Now, individuals with central sleep apnea, or CSA, they have episodes of stopped, slowed, or shallow breathing, and that occurs between a communication failure between the brain and the muscles responsible for respiration. So that is actually a neural deconstruct. There is no communication going. So in that case, you actually do stop breathing for a given period of time. Now, with both of the apneas, obstructive and sleep and central, they cause symptoms that are both prevalent during sleep and during the day. People with sleep apnea may not even realize that they are breathing abnormally during sleep. So, nighttime symptoms may be first witnessed by a bed partner or or a caregiver, and if you're older or whatever have you. But most of the time sleep apnea is pointed out by the person that's laying next to you, your husband, wife, boyfriend, girlfriend. Oftentimes your children will let you know that you're snoring and you stop breathing, especially if you fall asleep on the couch or something of that nature. The main symptoms of obstructive sleep apnea are excessive sleepiness during the day, snoring that is often loud and may sound like you're choking or gasping for air, dry mouth when you wake up, morning headaches that occur frequently and lasting for hours, nighttime awakenings and restless sleep, frequent nighttime urination, mood changes during the day such as irritability, decreased concentration, or attention span. Those are the main symptoms of obstructive sleep apnea. Now, a lot of people have gone on and gotten medication for mood disorder because they thought they had a simple mood disorder. Whereas they may have had sleep apnea and that was the reason for that mood disorder, and they may be taking medication inadvertently. So that's something you may want to address if you also have sleep apnea, or if you think you have sleep apnea. If you think you have sleep apnea, or if you think one of your loved ones has sleep apnea, hey, just suggest to them to have a sleep study done. You can have one from your general practitioner. You just go and you let them know, hey, I think I need to have a sleep study done because my wife says I'm snoring, I don't feel rested, I'm tired all day long. Just general things like that, and they'll get you in for one. Now, the symptoms for central sleep apnea, excuse me, are pauses in breathing or abnormal respiration, difficulty staying asleep through the night, significant daytime sleepiness, chest pain or angina at night, shortness of breath at night, reduced concentration, and morning headaches. So basically, the main difference is the nighttime symptoms for central sleep apnea. You'll find that the breathing becomes erratic and shallow and raspy, and it's just not it's not normal. I mean, none of it's normal, but this is even more abnormal than usual. But like I said, it's not as common. Central sleep apnea itself is not as common. It affects less than 1%. So most of the time when people have sleep apnea, most of the time it's obstructive sleep apnea. And that can be remedied through CPAP, oral appliances, position therapy, Inspire therapy, which is something very new on the market. And that's what I'm actually going to talk about in another episode when I'm going to discuss the different modes of therapy. But right now, we're just going to finish up with sleep apnea. So, when you want to talk to your doctor, like I said, you want to talk to them and let them know, you're feeling tired, even after sleeping 7 to 9 hours. You're falling asleep at inappropriate times, like while you're driving, while you're sitting at your, kid's recital or, sporting event or something. You're having frequent migraines in the morning. You're awakening from sleep with a feeling that you cannot breathe. You have dry mouth when you wake up. You have diminished concentration and ability to focus. And you're reliant on caffeine or energy drinks to get through the day. Then you might really want to, that's when you want to go to your doctor. And you want to let your doctor know these things. Because most people that these symptoms assume that they're being caused by something else, which is main reason why sleep apnea is underdiagnosed. So what you do is you go get your sleep study done, and you can either rule out sleep apnea, and if that's the case, then you can go on and seek treatment for something, for whatever else, maybe the causation of the feelings that you have. But if it is sleep apnea, then you want to go ahead and get that treated. And then notice the changes. And then if those feelings are still there, then you can go on and, work from there. But this way you're not treating everything else without at least attempting to find the underlying cause. So the main things that cause like central sleep apnea, like I said, the lack of the proper signals. The brain stem is what sends the signals for breathing to speed up or slow down breathing in response to the amount of carbon dioxide in the blood. But if the brain stem is not detecting the proper amounts of carbon dioxide, that's why it's not. So your CO2 detector is faulty, and it's causing your brain not to register that. Just like your CO2 detector, in your smoke alarm, in your car, all these things, they have a CO2 detector to detect for carbon monoxide, carbon dioxide. Those things, they have an alert to trigger that. Well, our brain has an alert to trigger that. And if that alert is not going off, then, you're not going to breathe when you should. So, those are the major factors for the major components of sleep apnea being central and obstructive. The major factors for sleep apnea, and I'll say these in closing, the major factors for sleep apnea are sex, and men are twice as likely to develop OSA than ladies are. The age has a lot to do with it. The risk of OSA grows as a person gets older, and it levels out once you get about 60. It doesn't usually get worse when you get 60 unless you gain exorbitant amounts of weight, because that also has a lot to do with it. The obesity, your BMI, your higher body mass index, they have a higher risk of having OSA, as well as specific anatomic features, having a tongue, a large tongue, a lower jaw that is short, and a short, stout neck, cleft palates, birth defects, things like that. They can be huge risk factors to how it can become more likely for a person's airway to become blocked during sleep. Sleeping on your back, smoking cigarettes, frequent nasal congestion, having a family history of OSA, using drugs, sedatives, alcohol, having lung, heart diseases, thyroid disorders, things like that. All that can have a effect on it. Chronic medication use can have a lot to do with it. A stroke, a brain injury, heart failure, high levels of growth hormone, kidney failure, those things can affect more of being causations for central sleep apnea, but they can also, lead to obstructive sleep apnea as well. But the most important thing is acknowledging the symptoms. And once you acknowledge those symptoms, go ahead and address them. Go ahead and schedule that appointment to go see your doctor, and have your doctor send you to a sleep specialist so that you can go ahead and have a polysomnogram done. And we'll talk about what a polysomnogram is next week. But until then, tune in. Same sleep time, same sleep channel. This is your host, D Boogie, and you have watched The REM Whisperer. Sleep well. 1.